Hi, my name's Amanda and I'm a pharmacist. Today I'll be talking about drug dosage forms. And if you find this video useful, please press the like button and subscribe to my channel and share it with others who may find it helpful too. Thanks, I really appreciate it. So first we'll start with what are drug dosage forms. Dosage forms are how drug products are formulated for delivery to the body and presented in the market. Some examples: tablets, capsules, solutions, and creams. We'll be looking at these in more detail. Now we'll look at the content of dosage forms. Dosage forms contain the active ingredient, which is the drug, and also chemically inactive or inert ingredients. And just to look at some of the type of inactive ingredients, there are additives, which are just additional formulation aids needed to prepare the dosage form. There are diluents, which are additives to increase the bulk, weight, or volume. Excipients, these are inactive substances used as a carrier for the active ingredient. And preservatives, these are substances to slow, minimize, or prevent bacterial growth. So why are dosage forms necessary? There are challenges to easily and accurately delivering a drug in its pure form. This is why dosage forms are needed. And just to look at some more detailed reasons why dosage forms are needed: for accurate dosing, for optimal drug action, for protection of the drug from the environment, for placement of drugs within specific body areas, for protection of the drug from stomach acid, for sustained or controlled release medications, for masking a bad drug taste or odor, and drug solubility issues. Now we'll look at the classification of dosage forms. Dosage forms can be classified by route of administration, which is the way they're taken: oral, topical, rectal, parenteral, which is injection, vaginal, inhaled, otic, which is by ear, ophthalmic, in the eye. Or they can be classified by physical form. This will be solid, liquid, and semisolid. And for this video, we'll be looking at dosage forms classified by physical form. We'll look at routes of administration in more detail in a later video. So first we'll begin with the solid dosage forms. Solid dosage forms are easy to package, store, transport, and dispense, and they have very accurate dosing, and there is little or no taste or smell. So that's some of the benefits of solid dosage forms. And some types include capsules, tablets, lozenges, suppositories, powders, and granules. So first we'll look at capsules in more detail. Capsules consist of an enclosed drug within a gelatin shell. After 10 to 30 minutes in the stomach, the gelatin capsule dissolves and the drug's released. Capsules are good for minimizing bad tastes and odors of drugs, and they are available in a wide range of colors and sizes. This makes product identification easy. And there are different types. There are hard gelatin capsules and soft gelatin capsule types. Next we'll look at tablets. Tablets are the most popular dosage form. They're formed in molds or by mechanical compression. Dissolution, which just means dissolving, must occur for the drug to have its pharmacologic effect. And there are many different types of tablets, and we'll look at those in a little detail. So first we'll look at chewable tablets. Those are just tablets that are chewed before swallowing. Enteric-coated tablets. These tablets have a special coating to prevent dissolution in the acidic environment of the stomach. They dissolve in the intestine instead to protect either sensitive drug from the stomach acid or to protect the stomach lining from injury by the drug. And one example of this would be Enteríc-coated Aspirin. There are extended release tablets. These are formulated for a long, slow release, and these tablets must not be crushed or chewed. There are buccal tablets. These are tablets that are dissolved slowly between the cheek and gum. Sublingual tablets. These are tablets dissolved under the tongue for rapid absorption, for example, nitroglycerin for chest pain. There are film-coated tablets. These tablets have a special coating to mask tastes and odors or to protect sensitive drug from air or light. There are pellets. These are tablets that are pellet-shaped that are placed under the skin for prolonged absorption. And there are effervescent tablets. These are dissolved in water before being administered. So basically the way they work, you have the drug in them with an acid and a base, and when they're placed in the water, there's a release of carbon dioxide, and that's where that fizz comes from. Next are lozenges. These are hard circular or oval-shaped dosage forms with a drug contained in a flavored sugar base. These dissolve slowly in the mouth to keep the drug in contact with the throat or mouth longer. They're also known as troches or pastilles. And just some examples: cough drops, sore throat drops, or NCLEX troches. Next are suppositories. These are solid dosage forms designed for rectal, vaginal, or urethral insertion. Rectal suppositories are composed of an inactive ingredient that carries the drug and melts or dissolves after inserted, releasing the drug over a prolonged period of time, and the effect can be local or systemic. And vaginal suppositories are sometimes called inserts, particularly when they're made as a tablet-looking form. Next are powders. These are finely ground mixtures of dry, inactive ingredient and drug. They can be used externally or internally. Externally, they're just usually dusted or sprinkled on the affected area, for example, a Nystatin antifungal powder. And internally, they're usually dissolved in water prior to ingestion or use. Some examples include Miralax powder or amoxicillin powder for reconstitution as a suspension. Next are granules. These are actually powders that are wetted, allowed to dry, then ground into coarse, irregular pieces. They have a larger particle size compared to powders, and they're more stable. Water can be added at the time of dispensing to prepare a solution or suspension with these. An example includes the clindamycin granules for reconstitution as a solution, or they can be sprinkled into soft food for ingestion. Examples include Lamisil oral granules. Now we'll look at the liquid dosage forms. These have a quicker onset of action than solid dosage forms since dissolution isn't required before absorption occurs. They're easier to swallow, so that's why they're often used for pediatrics or geriatric patients. And the liquids allow for alternate administration sites. They're liquids for injections, IVs, inhalation, and eye and ear drops. And some types of liquid dosage forms we'll be looking at include solutions, suspensions, syrups, emulsions, elixirs, and tinctures. So first we'll start with solutions. Solutions are homogeneous, which just means evenly distributed. They're a homogeneous mixture of one or more dissolved drugs, which is called the solute, in a liquid vehicle, which is called the solvent. No drug particles are seen when they're held up to light. It completely dissolves and is evenly distributed. So the drug does not settle to the bottom. There's no need to shake it before use, so you don't need that shake well auxiliary label for solutions. Solutions have both internal and external uses, and there are a couple types of solutions. There are aqueous solutions, which means water is the solvent. This is for injections, sprays, washes, gargles, douches, enemas, or irrigations. And there are non-aqueous solutions. This means they have a solvent other than water. Oftentimes it's alcohol with water or just alcohol. Next we'll look at suspensions. These are a mixture of very small particles of an insoluble drug, this means it won't dissolve, in a liquid. Small drug particles can be seen floating around when it's held up to light, and then eventually they settle to the bottom. Suspensions need a shake well before use sticker. The drug particles, they do settle to the bottom, and the correct dose will not be received without shaking before use. And there are suspensions for internal and external use. And just some examples, there's amoxicillin oral suspension after the powder is reconstituted, and calamine lotion is a topical suspension. Now we'll look at syrups. Syrups are viscous, which means thick, aqueous solutions. They're a concentrated mixture of sugar or artificial sweetener and dissolved drug. They're commonly used in pediatrics with the sugar in there that of course has a better taste and can have better compliance in taking the medication. And they're also used for adult medicines. They're a good dosage form for drugs with a bitter or unpleasant smell or taste. Syrups do not separate, so there's no need to shake before use, and an example is just cough syrup. Now we'll look at emulsions. Emulsions are a mixture of two liquids that usually do not mix. One is oil-based or lipid-based, and the other is water-based. One liquid is broken into smaller particles and evenly scattered throughout the other liquid, and an emulsifying agent, such as acacia or gelatin, is used to keep the mixture from separating. And the way these emulsifying agents work is they have a water-loving or hydrophilic head on one end and a lipid-loving tail on the other end, which is known as lipophilic, to keep the water and oil together. And some examples include some hormone lotions and TPN formulations. Those are what's used for the IV nutrition. Now we'll look at elixirs and tinctures. These are non-aqueous hydroalcoholic solutions, meaning they contain water and alcohol. The purpose of the alcohol is to facilitate drug dissolution. These you need to be very cautious with, as alcohol can interact with a patient's other medications, and these are not for babies. Patients receiving elixirs and tinctures should be counseled about alcohol content, especially in geriatric and pediatric patients. And just to look at basically what they are, elixirs are a drug in sweetened water with alcohol. The content is usually 3 to 25%, and tinctures have a higher concentration of alcohol than elixirs. Look now at the semi-solid dosage forms. These are too thick to be considered a liquid, but too soft to be considered a solid, and therefore topical application. They're applied to a part of the body, the skin, mucous membranes, or rectal, vaginal, or nasal areas. And the types of semi-solid dosage forms include ointments, pastes, creams, and gels. And we'll look briefly at each of those. First, we'll look at ointments. Ointments are a smooth, oily, semi-solid preparation for external application to skin or mucous membranes. They can serve as a vehicle for topical application of drugs, emollients, which are lubricating agents, or skin protectants. Most are designed for a local effect, not a systemic effect, but there is an exception that I'll point out, and that's nitroglycerin ointment. Pastes, these are ointment-like preparations that are stiffer, less greasy, and more water-based compared to ointments. They are used for application to oozing, weeping lesions because of their ability to absorb water. Next are creams. These are a semi-solid emulsion, which was the water and oil, containing suspensions or solutions of drugs for external use. They're a better choice for larger areas of application to avoid the greasiness associated with ointments. And gels. These are a semi-solid solution consisting of a solid diffused through a viscous liquid. Gels are sticky and transparent, and they're absorbed quickly by the skin. And something to note about the ointments, pastes, creams, and gels, they're all for external use only, so they need that external use only label on them. And now we'll just have a summary and just some key points to remember. Dosage forms are basically just how drugs are formulated. Classification of dosage forms by physical form includes solid, liquid, and semi-solid dosage forms. And just some of the special labels needed for certain dosage forms. Extended release tablets need a do not crush or chew label. Suspensions need shake well on them. Elixirs and tinctures need a caution contains alcohol label. And creams, ointments, and gels need for external use only. Thanks for watching. Please like and share this video with others who may find it helpful, and please subscribe to see more of my drug information videos. Thank you.